most people, when they consider issues with the neck or the head, is just that they're all separate units, that you actually have a neck, which is quite visible, and then obviously you have a head. What people fail to realize, it's actually the spine. When I go to touch someone at the neck level, I'm still not only having communication with the entire spine, but the rest of the system. Most people also feel that the range of motion off of a head can be judged of how the head rotates off the neck or the spine. And you can see that it differs. It's a little bit different going to the right side than off to the left. But also making these kind of judgments, the main part of the neck that's affected with this kind of communication is how the head turns off the back of the neck. What's interesting about the head in itself, to lift a head and just to realize the weight of the head, and that varies from person to person, but our system, our spine, our feet is carrying that weight, and how it affects the rest of the system, an effect of just the way the head is in its circumference. And what I mean by that, when you have a way of feeling and touching the head, you can feel, or I can feel, and sometimes my clients can feel, sometimes they can't. It all depends on the level of awareness. But when you start to rotate the head and feel how it actually is on the spine, not only do you find that certain areas of movement might not be as sophisticated as other areas of movement, but also that the weight of the head or certain areas of the head can have a variation. And what I mean by that is literally a left eye socket could be, in a sense, heavier to the system than the right eye socket, or the back of the head. Now this would be more obvious in issues, let's say, with torticollis, where most people are told that you have certain muscles that are short or contracting and pulling on certain bone areas. But you can have a situation as obvious as a Bell's palsy or a stroke where most people are seeing that there's a paralysis or you can't turn a certain way, or whiplash. It's very similar to having a tire that might have a bulge in it or it's unbalanced. Your car, your vehicle could still operate, but it starts really taking its toll on the rest of the system. And that's where even people can have lower back pain or middle back pain issues, but it really can relate back to how your whole system is organizing the head to movement. One of the most graceful ways we see a head move, let's say, is on a professional athlete, a basketball player, let's say. Their ability to use their system but have their head literally almost float on the spine to see where they are at all points, that they can react to that, is just fascinating to watch. And that's where one of the first ways they start to, quote, age as players, because that ability gets interrupted from somehow trauma to the system. They could have fallen, hurt themselves in some way, but in the way they don't realize that the relationship of how the head is onto the rest of the system is suddenly affected. So even as I'm talking here, I'm still doing all these slight movements of seeing how the head is in relationship to the spine. What you can start seeing is, again, how the movement is starting to change in the upper chest system. And if you don't think that everything's infected, I'm going to ask her to just tighten the right foot. And you can see how I'm actually had it almost tighten my grip, but I can't move the chest like I was just a second ago, as if the foot was just relaxed. You can let that go. So just because someone comes to me with trauma somehow to the neck or the head, or there's pain, and unfortunately that's when usually people do come for assistance, they don't realize that a lot of these habits can be reorganized prior to it actually being a more negative, like a pain or a movement issue where their body might be traumatized in some way. I might go after the feet just to see how the organization of the feet affects all the way up through the system to affect head and the neck function. So again, to start to see how the head can function on top of the spine, once there's a little bit clearer information on how my client's system wants to talk to me, the next thing I have to do is how it all affects the back. So it's very easy in many ways of actually starting to see how, just even again similar to what I just asked of tightening the foot, that if I touch certain ribs and how it affects the neck function, and then I'll go to the next and see there's already a little bit of difference in how I touch this rib in comparison to the next, and then also in here, and just see, because as you know, what I'm looking for is the spine to twist. And you can start to see that it does twist, but what also needs to twist is the chest cavity. And the chest cavity, what people don't realize, goes all the way around your system. Your chest is just not in front of you, it's the whole. So from anything from, again, maybe you didn't crawl properly as a child, having a surgery that can be traumatizing to the system, like an augmentation or something like that, where the chest cavity gets very rigid afterwards just because of the trauma to the system. And you can see how you're just working on how the head literally should float on the spine in different positions. And now, again, I don't necessarily have to put anything under her head, how it's just changed the way the head is on the spine, even just in lying down. So it's very easy just to take a moment and do this with your own head and just feel how you would look from side to side. Most people, again, would do it from the back of the neck. But feel what it's like, almost like an infant, or to be infantile again, to just not use any muscles, but just to use your skeletal system and feel what it's like to move your head from side to side. And see if you can feel what I was just discussing about, not only how the head is in relationship to the neck, but how the spine wants to twist. And does your chest move? And do you feel a twist from the lower chest cavity all the way up until moving the neck? And in this case too, I can ask her to tighten her abdomen muscles and just see how, just the difference, how just moving the head gets affected, and you can see it in the chest versus just letting the stomach go, and how I can move the head from side to side. And now I don't even have to work with the head in this point, just work with just how the neck responds. And also, if there was pain in her system, I wouldn't be able to do a lot of this. Pain's valid. It's very fatiguing. You don't breathe as efficiently as you do. You don't sleep as efficiently as you should. And most of all, the reason you have pain is because you don't have freedom in your system.